The most common reason for a missed period or a delayed period in a sexually active female is of course pregnancy. But just in case this time your periods have got delayed, you have missed your periods, but still your pregnancy test comes out to be negative, then it's definitely a call for you to get worried and troubled. So in today's video, I'll be letting you know of all the conditions where you can miss your periods might get delayed and you're still not pregnant. So without much ado, let's get started. The first is the menarche and the menopause. Now, there are two periods in the reproductive life of a female. Reproductive life means that is with the starting of periods up till the cessation of periods. The starting of periods as such is known as menarche, and the cessation of period, as you all must be knowing, it is known as menopause. So there are two periods in the reproductive life of a female, that is the menarche period and the menopause period. That's the beginning of menses and the cessation of menses. Now in these two periods there might be certain hormonal changes which might lead to the delay in periods. When a young girl starts with a period when she attains a menarche, then her hormonal levels might take some time to get stabilized. It might take somewhere between 6 months to 2 years, and during this period she might experience bleeding even every 15 days, or she might not experience periods. She might be missing out on her periods for as long as 6 months. So both these conditions are absolutely normal. If you are younger one, if your younger sister, or if your daughters experience long periods of amenorrhea, that is not having periods, if she's experiencing long periods of amenorrhea during the starting of her periods, it's absolutely normal. She just needs reassurance for the same. The same applies for the perimenopausal period. That is when the body is nearing menopause, the periods are about to be stopped. At that time also, the hormonal levels might be disturbed as the bodily functions are going to be stopped in terms of the reproductive functions. So during this course, the woman might experience periods very frequently, every 15 to 20 days. She might experience heavy bleeding, or she might experience very scanty menses, very little amount of bleeding, or she might experience long periods of amenorrhea or not having periods for a couple of months. Now, very important point to be remembered from the perimenopausal or the menopausal point of view is that if you're not having periods for as long as 6 months near to the menopause period, but then after 6 months, even if you are having a slight bleeding, it is termed as postmenopausal bleeding. That is having bleeding after the cessation of periods for as long as 6 months. If you are having postmenopausal bleeding, then it might be a cause of concern for you, and you should definitely consult a gynecologist for the same. Otherwise, you just need reassurance during the menarche and the menopausal period. Coming to the second point, that is eating disorders. In certain eating disorders in young females like anorexia nervosa and bulimia nervosa, there are severe distortions in the body image. That is, the patient might have severe distortions of her own body image, and in such a condition she might try to lose extremes of weight. For this, she might be eating very less in case of anorexia nervosa, or if she is taking a normal diet, then or she might go in for binge vomiting. That is, after having a normal meal, she might go in for binge vomiting in order to lose weight. So in both these conditions, anorexia nervosa and the bulimia nervosa, there is severe distortion in the body image of the patient. The patient is forcibly trying to lose weight. She might be very weak, frail and cachexic appearance, and she might experience long periods of amenorrhea. In such a condition, the patient, if identified properly, she needs to go in for a treatment in consultation with a psychologist, a nutritionist and a doctor or gynecologist at the same time, whereby her conditions can be taken care of. In the eating disorder, the other extreme, we have got very obese patients. They might experience obesity due to certain genetic conditions or due to unhealthy lifestyle, too much of eating, overeating, or certain medical conditions or certain hormonal imbalance. Now, both of these extremes of weight, that is extreme of weight loss and the extreme of weight gain, both might lead to certain hormonal imbalance, which in turn might lead to the cessation of periods or the delay of periods. So in both these conditions, you need to undergo certain lifestyle changes, and you need to go in for a treatment in consultation with a gynecologist, a nutritionist and psychologist at the same time. Now talking about certain medical disorders, certain conditions which lead to hormonal imbalance. In this, I would like to specifically mention about the thyroid disorders and the very rampant lifestyle disease of today, that is the PCOD or the polycystic ovarian disease, which I'm mentioning again and again. It has become very much rampant in today's young generation. Talking about the thyroid disorders, if a woman is suffering from hypothyroidism, she might experience unexplained weight gain, weakness or lethargy and other menstrual irregularities along with certain other symptoms. If you are experiencing any of these symptoms, then you should definitely consult your doctor for the same. And these diagnosis can be very easily made with the help of a blood investigation for thyroid. If you turn out to be hypothyroidism patient, then you need to take in a small amount of medication every day, which will take care of your hormonal milieu. Not talking about the PCOD, the polycystic ovarian disease, this can lead to weight gain and hirsutism or unwanted body growth all over the body and specifically the face, and it might also lead to certain skin problems like acne and pigmentation along with the menstrual irregularities. If you have gained weight because of PCOD, then it might lead to hormonal imbalance, in turn leading to the delayed periods and the very scanty menses. And this hormonal imbalance might further exaggerate your weight gain. So this becomes a very vicious circle which has to be taken care of. And weight loss coupled together with the regular intake of medicines for the treatment of PCOD or thyroid will be very beneficial for you in restoring your menstrual cycle and restoring your hormonal milieu. Coming to the next condition, that is hormonal imbalance. It is very important for you to note down that the menstrual cycle, the regular menstrual cycle takes place because of the hormonal milieu in the body. It is under the control of hormones like the gonadotropin releasing hormones, and then of course the gonadotropins like serum follicular stimulating hormone and the serum luteinizing hormone. Besides this, other hormones like the thyroid and the prolactin and the insulin also play a very important role. Now talking specifically about the prolactin hormones, if there is a disturbance in the serum prolactin levels, if there is disturbance in this hormone level, then it might also lead to long periods of amenorrhea and the scanty menses. Specifically talking about serum prolactin levels, if you are experiencing a slight milky discharge from your nipples from both the breasts, and if you are not breastfeeding, in spite of that, if you are having a slight discharge from the nipples coupled together with the delayed periods and the scanty menses, then do consult your gynecologist for the same, and she'll get your serum prolactin levels and the thyroid hormone levels tested. If the serum prolactin levels come out to be abnormal, then this might be reason for the milky discharge, and you need to take medicines for as long as 3 to 6 months, whereby your condition will be diagnosed and cured at the same time. Coming to the next condition, excessive exercise or excessive physical activity. Now, indulging in some form of workout or is physical activity for as long as 45 minutes, 1 or 2 hours every day is absolutely normal. But if due to any reason you are indulging in long hours of workout, long hours of physical activity, or you are a sports person or athlete and you are indulging in physical activity for very prolonged periods of time, then this might lead to hormonal imbalance, leading to the cessation of periods or the delaying of periods for a couple of cycles. In this case, you need to work upon your lifestyle, and you need to undergo treatment in consultation with a nutritionist and a gynecologist at the same time, where your condition can be definitely taken care of. Coming to the next condition, that is stress. Extreme stress, anxiety, depression due to any cause, it might lead to hormonal imbalance, and it might lead to delay in periods for 1 or 2 cycles. Now it is important to be remembered that the stress might cause a delay in periods for 1 or 2 cycles only. But if you are experiencing a delay in periods for a couple of cycles, then do consult your doctor for the same, and your condition will be definitely cured. Coming to last condition, that is the premature menopause. As such, a normal reproductive female experiences menopause, that is the cessation of periods, somewhere between the ages of 45 to 50 years. But if due to any certain conditions, there is a change in the hormonal levels and the woman experiences menopause before the age of 40 years, that is the cessation of periods before the age of 40 years, then it is termed as premature menopause. In such conditions, do consult your gynecologist, because you might be in need of hormone therapy and extra calcium and extra vitamin D supplementation for the same. So friends, this was all for today. Just to let you know, if you missed out your periods and what should be done in these cases and what conditions are responsible for the delay in your periods in spite of not being pregnant. I hope you have liked this video. If you have liked this video, then do press on the thumbs up or the like button. Do share it with the maximum number of friends and relatives so that they can benefit it from this valuable information. And in case you are sharing it, it will reach out to the maximum number of people. And my name is Dr. Shruti. I'll be seeing you all soon in the next video. Till then, what I say is stay healthy and stay happy, and bye-bye for now.